My name is Ketsi Pichadi. I am from TYVPT and my topic for rubrics 3 is a 6-minute walk test. First of all, the introduction. There are several modalities available for the objective evaluation of functional exercise capacity. Some provide a very complete assessment of all the systems involved in exercise performance, whereas others provide basic information but are low tech and are simpler to perform. The modality used should be chosen based on the clinical questions to be addressed and on available resources. The most popular clinical exercise tests in order of increasing complexity are stair climbing, a 6-minute walk test, a shuttle walk test, detection of exercise-induced asthma, a cardiac stress test, and a cardiopulmonary exercise test. Other professional organizations have published a standard for cardiac stress testing. The 6-minute walk test is a practical, simple test that requires 100 feet halfway, but no exercise equipments for advanced training for technicians. Walking in an activity performed daily, all but the most severely impaired patients. The test measures the distance that a patient can quickly walk on a flat and a hard surface in a period of 6 minutes. Now the indications. First indication, pre-treatment and the post-treatment. Compressions, lung transplantations, lung resection, lung volume reduction surgery, pulmonary rehabilitation, COPD, pulmonary hypertension, heart failure. Second, functional status, COPD, cystic fibrosis, heart failure, peripheral vascular diseases, fibromyalgia, and older patients. Now, a predictor of morbidity and mortality, heart failure, COPD, and primary pulmonary hypertension. Now limitations. The 6-minute walk test does not determine a peak oxygen uptake, diagnose the causes of dyspnea on exertion, or evaluate the causes or mechanisms of exercise limitation. The information provided should be considered complementary to cardiopulmonary exercise testing but not a replacement for it. The 6-minute walk test provide information that may be better index of the patient's ability to perform daily activities than is peak oxygen uptake. Now the contraindication. First is absolute contraindications for 6-minute walk test. Unstable angina during the previous month, myocardial infarction during the previous month. Now, relative contraindication, resting heart rate of more than 120, a systolic blood pressure of more than 180 mmHg, and diastolic pressure of more than 100 mmHg. Now, safety issues. Testing should be performed in a location where a rapid, appropriate response to an emergency is possible. Supplies that must be available include oxygen, sublingual nitroglycerin, aspirin, albuterol, telephone, or other means to call for help. The technicians should be certified in cardiopulmonary resuscitations with a minimum of basic life support. The advanced cardiac life support certification is desirable. A certified individual should be readily available to respond if needed. The physicians are not required to be present during all tests. The physicians ordering the test or a supervising laboratory physician may decide whether physician attendance at a specific test is required. If a patient is on chronic oxygen therapy, oxygen should be given at their standard rate or as directed by a physician or a protocol. Now the reasons for immediately stopping a 6-minute walk test. The first is chest pain, intolerable dyspnea, leg cramps, staggering, diaphoresis, a pale or acid appearance. Now, if a test is stopped For any of this reason, the patient should sit or lie supine as appropriate depending on the severity of the event and the technician's assessment of the severity of the event and the risk of syncope. The following should be obtained based on the judgment of the technicians: blood pressure, pulse rate, oxygen saturation, and physician evaluation. Now the location: 6-minute walk test should be performed indoors along a long, flat, straighted, enclosed corridor with a hard surface. If the weather is comfortable, the test must be performed outdoors. The walking course must be 3 meters in length. The length of the corridor should be marked every 3 meters. The turnaround point should be marked with a cone, such as an orange traffic cones. A starting line which marks the beginning and end of each 30-meter lap should be marked on the floor using brightly colored tape. Now the equipment needed. First is a countdown timer, that is, or stopwatch, mechanical lap counter, two small cones to mark the turnaround points, a chair that can be easily moved along the walking course, a worksheet on a clipboard, a source of oxygen, a sphygmomanometer, pulse oximeter, telephone, automated electronic defibrillators. Now, the patient preparations. First is the patient should be in a comfortable clothing, appropriate shoes for walking. Patient should use their usual walking aids during the test. The patient's usual medical regimen should be continued. A light meal is acceptable before early morning or early afternoon test. The patient should not have exercised vigorously within 2 hours of the beginning of the test. Now the measurements. The repeated testing should be performed about the same time of a day to minimize intra-day variability. A warm-up period before the test should not be performed. The patient should sit at a rest in a chair located near the starting position for at least 10 minutes before the test is started. During this time, check for contraindication, measure pulse and blood pressure, and make sure that clothing and shoes are appropriate. Pulse oximeter is optional if it is performed to measure and record baseline heart rate and oxygen saturation. Have the patient stand up and rate their baseline dyspnea and all over fatigue using the box scale. Set the lap counter to 0 and the timer to 6 minutes. Assemble all necessary equipments and move to the starting point. Now the what instruction that should be given to the patient? The object of this test is to walk as far as possible for 6 minutes. You will walk back and forth in this halfway. 6 minutes is a long time to walk, so you will be exerting yourself. You will probably get out of breath or become exhausted. You are permitted to slow down, to stop, and to rest as necessary. You may lean against the wall while resting, but resume walking as soon as you are able. You will be walking back and forth round the cones. You should pivot briskly around the cones and continue back the other way without hesitation. Demonstrate by walking one lap yourself. Walk and pivot round a cone briskly. Are you ready to do that? I am going to use this counter to keep track of the number of laps you complete. I will click it each time you turn around at this starting line. Remember that the object is to walk as far as possible for 6 minutes, but don't run or jog. Start now or whenever you are ready. Position the patient as at the starting line. Stand near the starting line during the test. Do not walk with the patient. As soon as the patient starts to walk, start the time. Do not talk to anyone during the walk. Use an even tone of voice when using the standard phrases of encouragement. Watch the patient. Do not get distracted and lose count of the laps. Each time the participant returns to the starting line, click the tap counter once or mark the tap on the worksheet. Let the participant see you do it. Exaggerate the click using body language, like using a stopwatch at a race. Now post-test, record the post-walk walk dyspnea and fatigue levels. If using a pulse oximeter, measure SpO2 and pulse rate from the oximeter and then remove the sensor. Now record the number of laps from the counter. Record the additional distance covered, the number of meters in the final partial lap, using the markers on the wall as distance guidance. Click the total distance marked, rounding to the nearest meter, and record it on the mark sheet. Congratulate the patient on good efforts and offer a drink of water. Now what interpretation? The formula for counting this is for men 6 meter walk test is equals to 7.57 into height in centimeter minus 5.02 into patient's age minus 1.76 into weight, and it should be in kg, minus 309 meter. And for women the formula is 2.11 into height, that should be in centimeter, minus 2.29 into weight, that should be in kg, minus 5.78 into age plus 667 meter. Thank you.